We can't start a health and safety session without acknowledging the effect of COVID-19 on our workplaces. We needed PPE, sneeze screens, and social distance protocols. That's what you could physically see. But what wasn't always apparent was the mental strain that finance workers endured during the pandemic. The world we have has been turned upside down. Customers are facing financial distress, and yet we still had to meet our sales targets. We're exposed to workplace violence as we tried to police mask wearing or in our dealings with aggressive customers. Finance workers in call centres experienced an increase in call volumes by up to 400%, while others worked excessive hours, especially as the lines between work and home blurred and as our kitchen benches became our new desks. The COVID-19 pandemic has exposed more closely what was and has been occurring in our sector. Many of us here are painfully aware of the more blatant forms of bad work, experiencing bullying or sexual harassment. These shamefully remain common in our workplaces. Even more widespread are the more subtle aspects of work that can erode mental health over long term. Long working hours, low autonomy, excessive job demands, job insecurity, and unfair targets, to name just a few. These preventable working conditions increase the risk of severe mental health conditions, ranging from burnout to depression and anxiety, and even to suicidal thoughts and behaviours. We also know that these same working conditions reduce productivity and increase the risk of cardiovascular disease and premature mortality. Today, we will hear from our NAB NEC, who will share some experiences from our NAB members who, in the pursuit of wage justice, have told us that management chose to ignore the harm that was being caused on workers. We're thrilled to have Marie Boland join us. Marie is a workplace health and safety expert, and she has worked with the ASU in South Australia as an industrial relations inspector and director of policy at SafeWork South Australia. In late 2017, Marie was appointed by SafeWork Australia as the independent review of the model WHS laws. I'm also introducing Liam O'Brien, Assistant Secretary at the ACTU, who leads the health and safety work at the council. Liam will be our facilitator today. Over to you, Liam.
Thanks very much, Justine, and thanks to everyone for inviting me along to this really important session. I'd also like to start by acknowledging traditional owners of the land on which we meet and pay my respects to elders past and present. So what I wanted to do quickly before I hand over to Mari, who's been doing some great work in work health and safety for the last 20 years, really, both as a union official at the ASU, but then in her work at SafeWork Australia, most recently, her review of the work health and safety laws, to talk about how work health and safety is going in this country. Because as some may have seen earlier this week, we had new data again on the impact of work on people's health and safety. And now for the 7th year in a row, we have seen an increase in the number of workers being seriously injured in workplaces. What's probably most troubling, and something that I know the FSU has really been focused on, has been the increasing risks associated with mental health conditions. And we've seen a massive increase in psychosocial hazards in workplaces that have caused serious injuries to workers. Now we have a situation where mental health conditions represent the fastest growing compensable claim in our work health and safety system. It's important to note, and I'm going to go through a presentation in a minute in terms of trying to paint a bit of a picture about work health and safety in this country, is that workers' comp statistics are really just the tip of the iceberg when we think about work health and safety in workplaces. So we're going to have Mari talk to us a little bit about her work, in particular the work that she did in reviewing our model work health and safety laws. But we also want to talk about some of the achievements that our movement have made in terms of trying to improve those laws, because what Mari did in terms of reviewing those work health and safety laws became a really important blueprint for our movement, and indeed for the FSU, to pick up some of those really important reforms, such as the need for better protections for workers' mental health, to champion, and reforms that earlier this year, following Work Health and Safety Ministers' meeting, we were successful at winning some improvements. We're hoping to see them implemented. But in order to set the scene, I really wanted to take everybody through some research that the ACTU has been doing. It's part of now an annual program of research, which we commenced back in 2019, and were unable to sort of keep it going through last year in 2020 because of COVID, to really understand and unpick the experience of workers when it comes to health and safety. So, as I said before, one of the problems we've got with understanding work health and safety is this reliance very much on workers' compensation statistics in terms of understanding the nature of illness and injury in work. And really, as we all know, it is just the tip of the iceberg in terms of the number of workers that are seriously injured at work. So what we really wanted to do was to unpack the experience of workers across the country, across a whole range of sectors, both within unions, but indeed from the general community in terms of their experience around work health and safety. This was about providing insights, not just for the ACTU, but indeed for each union across sectors, but also to be able to track those over time and understand how there might be changes and shifts in certain injury types and hazards. One of the really key things we did 2 years ago is we sent out a survey via unions, and we got close to 26,000 workers participating in it. And they provided a really good snapshot for unions, including the FSU, about what the experience of work health and safety was. But it didn't give us much of an insight into what's happening outside of union workplaces. And we know union workplaces are often safer and have a different range of challenges. But what we wanted to really understand was what was the community experience when it came to work health and safety. We also wanted to get a really good understanding about what the experience was of health and safety reps and union delegates and activists on the front line trying to make workplaces safe. So this year, along with a survey that we put out through unions, we also did a community panel. I'm going to take you through the results of that community panel, which was a representative sample of the community across the country. So we had good numbers out of each state and territory across the country, and a pretty good industry mix to understand what the experience was in terms of work health and safety. What was really troubling, and something that we've been noticing for some time, is the impact of working hours. And working hours is not just a serious industrial issue, and something I'm sure the FSU have to encounter. And it's not just a serious psychological or mental health issue, it's a serious health issue. Earlier this year, the World Health Organization nominated long or excessive working hours as the biggest killer of workers worldwide. About 750,000 deaths every year contributed to by long working hours. So things like heart disease, stroke, and other things. And working hours is a really significant issue in Australia, and we've seen it increasing now for close to 2 decades in terms of the increase in hours. What we also found was, permanent work and was still a declining feature of the profile of the workforce that we detected this year. And whilst only 15% were technically classified as insecure work, and that was some of the challenges we had with our survey panel, we found that insecure work is a really significant factor in people's work health and safety experience. And to give you an idea about hours of work, when I talked before about the impact of hours on your health, the World Health Organization and others nominate 55 hours per week or more as something that is seriously dangerous to your health. And we have seen increasing year on year the number of workers working excessive hours. What was probably most troubling, and if we think about the statistics that were released earlier this week, which put roughly about 120,000 workers last year experienced a serious injury or illness caused by their work that made a workers' compensation claim. What this actually shows is the rate of injury and illness is significantly higher. Roughly 29% of the general population experienced a personal injury caused by work in the last 12 months. To give you an idea, that's probably in excess of 10 times the number that are actually putting in workers' compensation claims. And about 80% of workers do not put in a workers' compensation claim when they are injured at work. About 95% of insecure workers don't put in a workers' compensation claim. So it gives you a bit of a sense just how much is missed when we think about those sorts of statistics. Really troublingly, 17% of workers, so close to 3 times the number that are injured physically, are injured psychologically. And that's consistent with the experience that we had 2 years ago. We found more workers experience psychological injury as a result of their work. And also, as I said before, in relation to workers' compensation statistics, these are the fastest growing injury types in the workers' compensation system. And this statistic here shows that it is just a fraction of the number that are actually experiencing it. Really troubling nearly as many people that experience a physical injury also experience a psychological injury from work. And often that is due to the nature of the hazards and the exposures that they've got, but it's also a nature of our workers' compensation system, where we see too often workers that experience physical injury then deal with a whole range of psychological issues because of the frustrations of the system. Again, the gender splits are pretty stark, and this is pretty indicative of the sort of gender segregation of our workforce. You know, women are more likely to experience psychological injury, men are more likely to experience physical injury. The reason I attribute this to gender segregation is because what we find when we dig underneath these statistics is that men and women in the same industry are generally experiencing the same types and rates of injury. So this is not a male versus female thing in a workplace. This is often to do with the gender segregation of work. Another really interesting factor in terms of work in 2021 is the experience of young workers. And this is something that, as an official, I've noticed, at least for my time as a union official and organising workers, is that young workers are much more vulnerable when it comes to work health and safety. And when we think about the sort of experience of people in their working lives, in particular when it comes to psychological injury, young workers are significantly more likely to sustain injuries as a result of their work. Really troublingly, a lot of workers don't seek help following injury. About half or so do seek medical treatment. About a bit over a third need time off. But as I said before, a really small fraction actually go through the process of a workers' compensation claim. And in the case of insecure workers, very few actually take time off to recover and rehabilitate from work. In terms of the types of injuries and the reasons people don't take time off work, this is just a bit of a summary as to some of the key issues that sort of stand in the way of workers taking time off. I said before that insecure workers were far more likely to say they have to not take time because they have no leave or couldn't afford to take time off. But they're also much more concerned about significant impacts on their work, and whether that be because there are no others to fill in for their work, but indeed pressure from employers in terms of not making workers' compensation claims as well. There's a couple of standouts in terms of industries, and it's unfortunate to say that finance is one of them, but obviously also retail is. 36% of retail workers suffered either a physical or a psychological injury in the last 12 months. Nearly 2/3 of education workers worked through with an injury because they had no relief in terms of being able to take time off. And 27% of finance workers experienced a mental injury in the last 12 months, with a further 5% experiencing a physical injury. 36% of finance workers reported regularly or always experiencing stress at work. And that's something that I know, listening to the introduction earlier from Justine, is something that is getting worse and worse every year with the pressures that banks and other finance employers are putting on workers. Unfortunately, sexual harassment and violence was a key finding in our survey this year. We found that 1 in 5 workers had experienced sexual harassment or gender-based violence in the course of their work in the last 12 months. That's consistent with previous reports. Obviously, there's a lot of focus this year on Kate Jenkins' Respect at Work report, which found that 1/3 of workers in the last 5 years experienced sexual harassment. So it shows that despite all the talk of this over the last few years, that the rates of injury and the rates of exposure to sexual harassment in workplaces is still really significantly high. And obviously, when it comes to action, there was really significant barriers in terms of workers taking action. And largely this went to the fact that workers were just not satisfied with the response that they were getting from employers, but also from regulators and other authorities when it came to complaints. So there's really a lot in it when it comes to sexual harassment in workplaces. What was really positive out of the report was, again, this sort of affirmation that union workplaces are significantly safer. On average, we found that union workplaces had a significantly higher rate of policies and procedures in work around health and safety. We also saw regular inspections around health and safety, and generally a better level of action when it came to dealing with health and safety issues. And this is consistent with a lot of the research in terms of when workers have a voice. And it's a key feature of our work health and safety laws, which I'm sure Mari will talk about in a moment, that participation and consultation is really critical to ensuring healthy and safe work. And unions are great at enabling that. Probably most obvious when it comes to the presence of health and safety reps. And this is something that I know the FSU is really dedicated to in terms of building good health and safety rep networks across the sector. What was really stark was the differences when it came to the union data when it comes to health and safety reps. And health and safety reps have been well established as one of the key determinants about healthy and safe work. When workers have got good engagement and consultation around health and safety issues in workplaces, they generally lead to better outcomes. And really on every measure, we saw in union workplaces a much higher level of health and safety reps, more likely to be elected by their colleagues, more likely to have processes in workplaces like health and safety committees where issues can be dealt with. So there's some really good news there. And this is just a bit of a sort of flavour of some of the things that we're detecting this year to sort of help set the scene for this discussion. But the purpose of today was also to really hear from Mari and the work that she's been doing when it comes to health and safety. And I think we wanted to have a really particular focus when it comes to psychological injury and psychosocial hazards in workplaces. So I wanted to start really with you, Mari. Obviously, it's now 3-4 years ago nearly that the review was completed. But a big feature of your review was really around the mental health of Australian workers and the fact that our legal framework hadn't really dealt with it appropriately. So I sort of wanted to sort of invite you to talk about what your experience was during that review, but why has it taken so long for us to catch up on this? Because these injury rates have been rising for some time.
Yeah, thanks, Liam, and good afternoon, everyone, and thanks for inviting me. So look, the question of why is it taking so long, I think I put that down to two key reasons. And the first is that the traditional emphasis of work health and safety has been on the prevention of physical injury, and physical injury arising from visibly dangerous work, and particularly the work that's probably in the past has been dominated by male workers. And so that's why you've got pages and pages of regulations on construction and mining and nothing on healthcare and banking, for example. And the second reason, I think, is that traditionally and even currently, I guess, when workers raise concerns about psychological injury or psychosocial hazards, they've tended to be dealt with by employers through individualizing the issue. So focusing on the worker who perhaps has made a complaint or raised an issue, and then diverting the issue into grievance processes and the human resource department, rather than looking at the issue in that broader organizational, cultural, work health and safety culture. Just listening to your presentation, I then thought, well, there's probably a third reason, perhaps, and it's probably to do with underreporting, or rather underreporting of workers through the workers' compensation system. Because I know when I was a regulator, we tended to focus a lot on the statistics coming out of the workers' comp schemes, and as you know, as everyone knows here today, there's a lot of underreporting, and I suspect that's even worse for psychological injury than for physical injury. I suspect a worker's more likely to make a claim for a physical injury than a workers' comp. Second part of your question, sorry, go on.
Just to pick up on that thing, because I think it's really important. Yeah. There's absolutely underreporting, but there's also an inequality in the way in which the two injuries are treated.
Oh,
so
absolutely.
If I fall over in my workplace, we have a no-fault workers' compensation system. It doesn't matter who was at fault, I make a claim, it's accepted. If it comes to a psychological injury, all of a sudden questions get raised about things like reasonable administrative action. And we don't apply that when it comes to physical. And I think that's a big factor also in the sort of underreporting and stigmatizing of mental health.
Yeah, and look, it's huge. And one of the experiences I had actually when I was working as a lawyer, most recently, I represented a lot of workers coming out of those administrative jobs, so similar to the jobs in banking, and the horrendous treatment of people who made workers' comp claims. And I noticed someone made the point too about self-insured employers, where a lot of the administration is internal, and yeah, like the experiences were just horrendous. So yeah, absolutely agree. In terms of what I discovered with the review, bear in mind, as you say, it was 3 years ago, so it was pre-COVID. So I was lucky in that I was able to travel all across Australia, and I heard from unions, health and safety reps, big business, small business, regulators, everyone, practitioners. And it came up consistently across everyone that there was a huge gap in the legal framework. And, that was, in some ways, it was surprising in the sense that right up to regulators, everyone was struggling, including regulators, as to how to enforce. Like there was no disputing that, like, the definition of health in the work health and safety laws includes psychological health. And so that whole framework is supposed to be there to support workers and support the system around preventing injury and enforcing compliance. But no one had a clue how to use it, including, the safety reps, regulators, everyone. So in a way, it was a no-brainer then for me to recommend regulations to deal with that gap. And so I mean, that's where we are, I hope, is that we will have regulations soon.
Yeah. Well, look, I mean, fingers crossed. We were really successful, and look, firstly, thanks to the FSU and the great work that they did. In particular, I want to call out Myrna, who did excellent work coming out and telling some politicians just what life is like when it comes to working in the finance sector. But I also want to pick up on some of the common threads I think about psychosocial hazards versus other hazards. And I think our work health and safety laws, when you point out before, they're pretty good when it comes to dealing with the really obvious, serious threats to health and life. It is disappointing. It's extremely distressing that, roughly 200 workers lose their lives in workplaces every year. A further 5,000 will die from diseases that are caused by their work. And really, when it comes to sort of, serious physical harm, our laws are well equipped to deal with it. When it comes to, harm that is caused by repetitive tasks, that is indeed, psychological injury, so often things we cannot see, it isn't so great. But actually, the base architecture of the laws are pretty good when it comes to rights for workers. And one thing I've noticed, and I think, this really provides an opportunity for us, is that, psych hazards and risk provide us with really good powers to deal with systems of work. And often these manifest themselves not just as health and safety issues, but indeed they mix in much more commonly with broader industrial issues like hours of work, issues like change management. What's the feedback around some of those issues? Because we often hear from the bosses, that's not a health and safety issue, that's an industrial issue. And how do we mix those two things together, so that we get proper action?
Yeah. Look, and I think that's a good question too, in the context of employers generally as well, who I think are trying to suggest that, you can't fit the current system, you can't fit the work health safety system around psychological injury, it's different. And I suppose I've been, as you know, as well as yourselves, trying to really emphasize that it isn't different and that it's not complex, it's simple. And so some of the things I really focus a lot on, things like the due diligence requirements in the Work Health and Safety Act, for example, which I don't believe has ever been really used properly, probably even in prevention of physical injury. But for example, due diligence requires a continuous examination of a business's work practices. And in the context of psychological health, that should include, and it does include, all those cultural and systemic factors that pose the risk. So that includes things like job control, job demands, workloads, staff ratios, that came up a lot, and particularly when I was talking to people from the healthcare sector around, just actually providing enough staff is a critical part of managing work health and safety. So I think there's significant scope already in the Act before we get regulations to really use some of those provisions to put the pressure on leaders, put the pressure on management. And also to come back to, like you were saying in your presentation around consultation, like when someone asked me recently, what's my hope for the new regulations? And I said, well, I'm really hoping that they provide a catalyst for a complete rethink in how places like NAB structure their approach to managing work health and safety risks. And what I mean by that is that, they will incorporate into that work health and safety management, much more accountable, committed and accountable leadership, clearly defined policies and procedures around psychosocial hazards, training, reporting, but most important of all, the whole thing has to be built on consultation, worker participation and empowerment. And like just anticipating, I guess, the next bit, perhaps, which is the feedback from that terrible feedback from the NAB survey, about, it just jumped out to me all the time, blind eye, turn to blind eye. And you think everything, I think, has to start with worker consultation and participation. I mean, you can't, it's just, that it just has to start from that, I think.
Yeah, I mean, I agree. I think one of the beauties of what we've got at the moment is a moment in time where we are going to improve our rights as workers and representatives. Yeah. So, the moving forward position is that workers will have more rights now than they've ever had before when it comes to requiring their employers to identify risks to psychological health, to review and assess those risks, and to apply controls. And all of those, they are legally required to consult with you at the very start. And again, because of that sort of intermixing with many of those vexed industrial issues, and you talked about staffing levels, which is a significant issue across a range of sectors, provides us really good levers to organise and try and, improve outcomes, get better controls in workplaces, increase staffing. So I think there's some real opportunities there.
I think particularly in the context, I guess, of the group that's having the conference today, I think some of the things I noticed in dealing or in supporting workers who were in similar jobs is I think there's an increasing focus on like performance targets. And for example, I know there was one worker who they were only allowed to spend 3 minutes on each call, and if this worker was in a PIP, this terrible performance improvement plan, and so he did 3 minutes 10 seconds, and that's a fail, and then the pressure that kind of built up over time. So, and then there was technology linked to that was measuring every second, and this was an older worker too. And that was another thing I noticed was increasing, like almost psychological pressure being used to manage people out of the workplace. So instead of fundamentally treating people with dignity and having conversations about how they might work better with new technology or new strategies or whatever, I found that often it was just, well, let's put the pressure on and break them, and then a lot of these people ended up in the workers' compensation system, even more psychologically damaged. I think there's also a renewed focus. I think obviously over the past, particularly 5 years or so, maybe more, people are beginning to talk more about mental health issues, and as we all know, the stigma is being reduced. Just touching on what the previous person said about, I think that is an interesting though, and also perhaps something we need to be looking at cautiously, that issue around people who already might have some mental health issues, and how employers, because that came up a lot when I did my consultation, it was employers saying, well, we shouldn't have to manage people who have mental health issues, you know, and almost putting it back on, you know, we've got a problem worker, as opposed to this, the work affecting that worker. And then that led down to, oh, well, we're going to have to do psychometric testing, you know, so there is that, you know, red flag there around how you manage that. Yeah, so I think it's a combination of more awareness around mental health issues, people being more prepared to talk about mental health issues. Yeah, and I think though as well, in terms of the timing of the review that I did, I think the time was perhaps right, and I'm not sure why, but as I said, everyone raised it. So it was a topic that, you know, it was obvious to most people who are involved in work health and safety that this was a gap that had to be filled. And while people might have differed in how it should be filled, no one disagreed with the view that, you know, the gap was there.
When even your workers' comp statistics as poor a representation of injury as they are showing, you know, significant growth in mental health issues. In fact, that not just one of the fastest growing injury type in our system. It's hard to ignore the fact that this is a problem. And I think COVID really accelerated that along.
Yeah. And of course, money talks, you know, I mean, a lot of the employers and the workers' comp schemes were interested, of course, because it's costing them, you know, so the more claims there are, the more money it costs too. So,
I mean, what's often not spoken about when it comes to mental health injuries, not only are they the fastest growing, but they take significantly longer to rehabilitate from. So, you know, I think the median time rehabilitation for a physical injury is something short of 7 weeks, whereas for a psychological injury, it's closer to 20. So significantly more, it's costing employers a lot more money by not addressing these sorts of issues. But I wanted to come to the, sorry, go on.
I just had a thought that came part of that big question you asked me about why now. But I think the other interesting thing that was, it's just come to me actually in this conversation is, it's also because I think if you look at our regulations, in the work health and safety regulations are in these kind of industry chapters, you know, so mining, constructions, whatever, but psychological health issues were raised across every single industry and every single work that's being done. So it was like a construction union raised, you know, the fly in, fly out workers. You had nurses raising, you know, isolated remote work, teachers, bank, you know, occupational violence, frontline staff, the whole works, you know. So I think it's also, you know, that combination of, well, strength in numbers, which we all know about, that this, it just touches everyone. I think everyone has somebody, either themselves or a family member, who's being badly damaged by work. I think everyone has their story of a terrible performance review or a restructure that's been managed really badly, and a lot of people just leave, and as you say, don't become a part of the statistics, but it's out there and everyone can relate to it.